Doctors and nurses are heading to New York State's battered healthcare system to help out. Meg Tirrell tonight with Andy Slavitt, a healthcare investor who served in the Obama administration, who is now helping with the effort to bring more troops, doctors, into this fight. Meg?
Tyler, thanks so much. And Andy Slavitt joins us on the phone tonight. Andy, you were tweeting about this over the weekend, and I thought your ideas were just super interesting. I mean, you were basically pointing out there's a disconnect between the supply of healthcare workers in some areas where they're being furloughed and the demand for them in areas like New York. Tell us about the conversations you've been having with local leaders and how this problem could be solved.
Sure. So in New York right now, where we have the most significant shortages, respiratory therapists can make up to $15,000 a week and have complete transportation, hotel, and guaranteed protective gear. Nurses and physician assistants likewise. The challenge that New York is facing as they get more ventilators and as they get more supplies is it's actually one of labor. And interestingly, where I live in Minneapolis, we have a lot of nurses and respiratory therapists that are kind of the Maytag repairmen. They're furloughed, they're laid off, and they're just sort of waiting for things to come hit in Minneapolis as they've ended elective procedures here. So we've tried to begin a program to allow people who are willing to go to New York and be heroes to be able to do that. Some are doing it voluntarily. Some can do it at great pay, and we think this is how the country pulls together in a crisis like this.
What are the hurdles to making this happen, regulatory speaking, or just a leadership focus? You know, how do you make this happen? What are the things standing in the way?
I think it's getting the word out now, because under normal times, you'd have licensure issues. People wouldn't be able to go from place to place. People wouldn't want to let their employees move around. There were just a whole bunch of reasons that in peacetime don't apply right now. And so I think the effort and energy of people who really want to help, particularly the New York public hospital system, is one that I think it's an enormous opportunity. We understand the danger that faces the medical profession right now. And the people in New York, many of them working 18, 20-hour days, 7 days a week, they need a break. They need replacement. And if there's replacement troops that can come in, even for a few weeks, to help handle the peak, I think, while I know it's challenging, these are experiences people are going to tell their grandkids about, how they kind of went to the rescue, as many did in 9/11.
Well, I want to ask you also about something we've heard from Dr. Scott Gottlieb about as well. And of course, you guys were part of different administrations. He was the Trump administration's former FDA commissioner, and you served under Obama in CMS. But this idea that we need to be testing, tracing, and quarantining people like South Korea has done if we're going to effectively lift these social distancing measures. What more do we need to be doing there?
So first of all, Scott and I are both, I think, come from a similar cloth, in that neither one of us, we both come from the business side. Neither one of us are particularly partisan, and we both had, I think, pretty similar tenures, and we talk all the time. He put together, I think, along with several other people at AEI, I think a really smart roadmap, if we can hew to it, that does depend on our ability to dramatically ramp up testing. I think what the Trump administration needs to do, however, is they need to appoint a single individual to lead all the testing efforts and become a testing czar, much in the same way Scott was talking about picking some winners and placing some bets on biotech and pharma companies. We need to do the same thing with testing. What you don't want is to have one testing company that has all of the swabs, but none of the reagents to tell you what the results are, and another company that has plenty of reagents but not enough swabs. And if you don't orient your supply chain towards the people that are going to be delivering the results, you're never going to get enough tests made for this country. And so while Scott has the right idea, right now we have not oriented the supply chain well enough. And remember, we're competing with hundreds of countries around the world that got on this sooner than we did. So we are at a disadvantage in chasing that global supply chain. So we need to be smart about it. We need to act about it. We need to catch up.